Recording's rolling.
Peanut butter and jelly, ham and cheese. It's like these things go together, sort of like orthognathic surgery and buccal fat pad surgery. I noticed that a lot of my patients who have or request buccal fat pad surgery are also interested or have actually had orthognathic surgery. Orthognathic surgery is essentially moving of the upper and lower jaw, or the maxilla and the mandible, in a way that allows you to have a better bite, or occlusion is what we call it. Because the two are so linked, I would say maybe 5 to 10% of my buccal fat pad patients have had or are considering orthognathic surgery. It warrants the question, does orthognathic surgery make it more challenging to do buccal fat pad removal, or vice versa? This is a question that nobody's ever asked me, but I think deserves explanation. So here goes. During the performance of double jaw surgery, essentially incisions are made on the inside of your mouth, along the back angle of your inner mouth, also along the top teeth. Both of these incisions, if extended laterally, can expose the buccal fat pad. If that buccal fat pad is exposed, it can be reduced back into the pocket and repaired. However, once you've done that, one of my thoughts is it creates scar tissue that makes subsequent buccal fat pad removal more difficult. And that's why one of the biggest contraindications or reasons not to do buccal fat pad removal is if you've done it before. In another video, I'll talk about what happens when you attempt to go back in and take this buccal fat pad out. But for now, I want to focus on the original question. Does having double jaw surgery affect buccal fat pad removal? The answer is potentially yes. However, in today's surgery, and we'll be showing a reel from that, we performed just this operation and it had absolutely no impact whatsoever on a patient who previously underwent BSSO surgery, or bilateral sagittal split osteotomy, which allows you to move the jaw forward. So the answer is an annoying one in the sense that it's not a hard yes or a hard no, but the fact that it's a potential possibility should allow people to understand and attempt this procedure safely. If you do endeavor to undergo buccal fat pad removal after having double jaw surgery and it's difficult, I think that's a reason to abandon the operation. But in most cases, this will not be the case. I hope you have a great day. Thank you so much for watching this video.